basilar skull fracture. Okay, so one thing to note, this type of a fracture, it cannot be identified through an X-ray. Most of the time we say, for you to recognize a basilar skull fracture, you depend on the clinical presentation of the patient. Okay, that is say it happens at the base of a fracture. No X-ray, no MRI can expose this type of injury. So you rely on the clinical sign. Which are some of the clinical signs? One other thing is CSF, what you call the cerebral spinal fluid leak. And one thing that I want to tell you is that this is the first sign. This is the sign that you pick in the pre-hospital. The other signs normally they happen as they are late signs. Most of the time you may not, before they develop, you'll have handed over this patient to the hospital. But another sign you expect is, one is the battle sign. That is when you have the battle sign that we say mostly there's ecmosis over the mastoid process. This is around the when you see this, know that it's a fracture at the temporal bone. And most of the time, you'll find that this is the discoloration around just behind the ear. So apart from that, we can have bleeding inside the ears. When you check inside, you can also see that discoloration, and that is another sign. And also we can have the discoloration around the eyes. That is a sign that we call a raccoon eyes. You expect those four signs of, those are the four clinical signs of basilar skull fracture. One thing to note for this type of a skull fracture, most of the time it is associated with traumatic brain injury and the nerve, also nerve damage. So whenever we see all these signs of a basilar skull fracture, just know that the brain is at a high risk. Also do neurological examination to find the function of the brain. Or in your management, ensure you manage this well so that the secondary brain injuries don't develop. Okay, let's look at the third type of a fracture, and that is a depressed skull fracture. So for the depressed skull fracture, mostly affect the parietal bone and frontal bone. Mostly 30% of these fractures are associated with hematoma and laceration, cerebral contusion. And if the breast is greater than thickness of the skull, we can have what we call a dural laceration.